Good day, everyone. We are the University of St. La Salle, BSN 3B, Group 1A, and we will be presenting our poster presentation in partial fulfillment of the requirements of Nursing Research 115B for Bachelor of Science degree in Nursing. I am Renee Grace Abunda.
Naljan John C. Ablao.
Michael Dapon.
Aramea Recivita.
Gabriel Therese Balibalos.
And Seymour Hasikaram.
And we will be talking about our project entitled Social Isolation and Mental Health of Nursing Students During the COVID-19 Pandemic. Social isolation, according to Forlex, is the state of separation or being alone. Due to the pandemic, we are propelled to do distancing, which may lead to social isolation. Quarantine in adults generally has a negative psychological effect, which pertain to the social isolation that they may feel. Mental health conditions, on the other hand, worsen due to the inability of access to peer support groups and face-to-face services. 83% of the 2,111 participants of the survey of Young Minds concurred, as stated according to Lee.
In this presentation, we would like to focus on the main objective, and that is to aim to be bridging the gap on whether social isolation has a significant association with the mental health status of the students and the adverse effect of social isolation on the mental stability of the students. Pertaining to answer our main objective, we also would like to answer the following questions. Is there a significant association in social isolation and mental health of level 3 nursing students when grouped according to age, sex, location, and connectivity? Is there a significant association between social isolation and mental health of level 3 nursing students during COVID-19 pandemic?
For the methods, for our research design, quantitative method was used to determine the results. For our study sample, participants will be level 3 nursing students with a sample size of 125 from the use of Sloven's formula. And for our instrument research, researchers made questionnaires with 50 questions. The good and SCIT's reliability is 3.67, indicating a very good reliability. Tranbox alpha was also used for the questionnaires with a reliability index of 0.890, which means valid and reliable.
For our results that try to answer objective number 1 earlier, Table 1 has results that shows whether there is a significant association of social isolation to the following variables, such as age, sex, connectivity, and location. The table shows that there is no significant association in the social isolation with aforementioned variables, due to all the respective p-values being greater than 0.05. Therefore, the variables don't directly contribute to social isolation. Going to table number 2, it shows results whether there is a significant association of mental health with the aforementioned variables, and based on the table being presented, it can be noted that there is still no significant association in the mental health with said variables. With their p-values all being greater than 0.05, this means that variables do not directly contribute to mental health.
Table 3 shows the significant association of the level of social isolation and mental health. It indicates that the hypothesis was rejected. With a p-value of 0.000, it shows that indeed there is a significant relationship between the social isolation and the mental health of level 3 nursing students. It implies that as respondents isolate themselves from people, there is an effect towards the mental health of an individual. As supported by the study of Usher, Baller, and Jackson in 2020, the effect of social isolation to individuals can become a catalyst for many mental health issues. With this, we can state that as the degree of social isolation increases, mental stress of the nursing student also increases. For the generalization of findings, Factors such as sex, age, location, and connectivity may not contribute to the social isolation and the mental health of a third year level student that they may experience during the pandemic. However, mental health is affected when isolated. When isolated by quarantine, people will more likely experience negative psychological impacts than those who can communicate with their peers. Social isolation and its association to mental health is even more prominent during pandemic.
Taking into consideration that there is an association with the level of isolation and the mental health of nursing students, this may state that the level of isolation is crucial to the perception of one's mental health. Therefore, level 3 nursing students must take the time to socialize with peers to promote care for their mental health. For the summary of recommendations, the student must become actively informed and participative in the designing of the new program that will prevent social isolation in the midst of the pandemic. For the College of Nursing, they must review and make changes to their methods delivering the curriculum to sustain a good mental health. For the Guidance Office, they must enact programs that will tackle the management of stress to lessen the perceived social isolation. The Student Affairs Council must create a sequential process in various platforms, such as social media, that will aid in voicing out their concerns and addressing the needs in the aspects of mental health. For the parents and guardians, they must become more aware of the current health situation of the student, providing good support.
This concludes our poster presentation. If you have questions and concerns, we will be glad to address them. Thank you for listening, and God bless.